Hey, yo, everybody. It's another Monday. So I'm going to try to make this video real quick. I always say that. But anyway, try to make it real quick. So the last video I talked about my pre-op appointment and how that was going to go. And still trying to wait to hear back from insurance up until the moment. But so I went to the appointment. It was last Wednesday. Everything was great. From this perspective is from the perspective of, it wasn't what I wanted to hear initially, because it turns out the insurance doesn't cover anything really with the Hypercure. But it was like really bad news, but then good news in the end. And sometimes, I mean, it's more than just the silver lining. It's like, what's really good for you at the moment. You know, I could have potentially taken out a loan for the amount that it was going to cost, which is it's going to be like $6,000 about to get it done per foot. But then the doctor really like leveled with me, and she really just gave me some really good advice. She said, "Hey, look, I don't know what your financial situation is. You can go ahead and go through with it. You can take care of it, and I'm more than willing to put the implant in there." She's like, "But I gotta be honest with you." She's like, "You know, most of the patients, about 80% of the patients that I put them in are adolescents. I'm not an adolescent. I'm 35. Okay." She's like, "But I have put them in a lot of adults. But, two buts, of those adult patients, I take a lot of them out." And I was like, "What?" She's like, "Yeah." She's like, "To be honest with you, like, yes, it corrects the misalignment, but there's just so much pain involved in the healing process and the recovery. So even at a year out, 2 years out, you're just not the same. Just because you have this foreign object that's like in a space where it's not designed to have anything in the space, like propping it up, so it hurts. Like, you know, it just, if you can hear the GPS, I'm sorry, and I'm not gonna redo this video, but I'm headed to a place real quick. So she was like, "You know, to be honest with you, if it's more than just like a pain thing, you know, like the mental," like she said, "I get the mental aspect of it as far as the security. You want your feet to not look like they do. But there's things that we can do, not necessarily to fix the aesthetic value, but we can strengthen up the ligaments that are inflamed, strengthen up the muscles, and get all that stuff working correctly, so that you can be seemingly pain-free and have mobility and be fine with work." So I said, okay. And I liked that. Honestly, I liked the way that sounded, like that perspective. You know, a lot of doctors won't say that. They'll be like, "Hey, look, you need this surgery or else, you know, that's it for you." But that wasn't her stance at all. She said, "Hey, look, I mean, with therapy and with blah, 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 medication, anti-inflammatories, and everything else," she said, "I'm confident that we can get you to a place to where you're comfortable, to where, you know, based upon your symptoms and what I've told her." So yeah, so I said this is going to be short, and it's fairly short. But anyway, long story short is that it's Monday the 17th. As I'm actually under 48 hours away from my surgery, I am getting the Austin bunionectomy done to my right foot. So that'll be Wednesday morning at 7:30 a.m. They're gonna cut me. So that's that. I'll keep you updated on the procedure. Take some before and after pictures. I did ask her if she could take some pictures, and she said, "Yeah." But I don't know if she like understood like what I was really asking. I was like, "I want you to like take pictures of like the procedure, and maybe like when I get there, we'll have a conversation. Maybe I can sneak some in. So we'll see what happens. But anyway, be in prayer for your boy. Yeah, a little under 48 hours away. So I'll probably try to make a video like the morning of and post it, and then when I get home, do a post-op, post-surgery video, and yeah, we'll go from there. All right, peace out.